Hi, this is Brandon Pounds. Welcome to another exciting video. We're working today with our Category 1 and for our SOT class. Our first assessment is going to be for the leg length analysis. Take the patient's legs. He's going to externally press on my hands, 1, 2, 3 seconds there. Now I'm checking for which one's the short leg, and I'm assessing from the medial malleolus. Looks like the right leg is more superior, and that's going to be my short leg. So right leg is going to be our short leg in this analysis. Next step is going to be our trap fiber analysis, and we're going to move from lateral to medial, starting with points 1, moving to 7, ending at the TVPs of T1. So we're going to palpate the tenderness at each of those points, starting from the AC joint, right here. So there's 1, 2, 3, 4 being our middle section, 5, 6, and 7. So which one of those was most tender to you?
4 on the right.
4? 4 on the right? So right here, okay, so 4 on the right is going to be our side. According to our chart, trap spot number 4, tenderness is going to be associated with our lumbar number 2, our thoracic number 6, and in our cervical region, cervical number 4. Okay? Now from there, we're going to check each of those to find which one is most tender during our analysis. Okay, so I'm checking for L2 here. Okay. There's 2, 6, there's 4. Okay, which one is the most tender, sir?
The low one.
The low one. Okay, so from here, what I'm going to do is I'm going to take my knife edge contact with an I to S pressure, and we'll thrust right through there. Okay. So the next step is going to be for our heel tension test. The way this is going to work is we're going to do it bilaterally. We can do it one leg, and then we can also do what's called an Achilles test. In the Achilles test, the thick side is going to determine which one of them is going to be the short side. Okay. So what I do is I take the patient. Okay. I feel which one's most tender. Okay. I can do it one way, and then I can finally end up with our Achilles. This right one right here is again the one that's it's the thickest one, meaning that's going to be our side of our short leg. Okay. The next step is going to be for our atlas dural subluxation, and the way that's going to work is we're going to apply a dorsiflexion to the foot and have the patient turn his head left to right and look for absence or presence of a reflex there. So pushing here, have the patient turn his head to the left, turn his head to the right. One more time, to the left. Good. All right. Thank you, sir. Okay. So no absence would mean that there is an atlas dural subluxation. We do not see one on the right side right here. So this is going to be a short leg, meaning our left leg is on this side here. Now to assess that, I'm going to have the patient hold the end of the table there. I'm going to grab here, I'm going to pull superior and inferiorly, holding that. The patient will not move his head. Holding that there 5-10 seconds. Flipping over to the short side, I'm going to do the same thing again, and this time the patient will rotate his head from left to right. Good. So the patient did it 3 times. Awesome. Very good. We'll check again. Thickness has gone away. They're both equal there. Next step is going to be our blocking for Category 1. And we said that the right side is our short side. So what we're going to do is we're going to take our blocks. So for intensive purposes, these will be our blocks. So what we'll do is on the short side, we'll go from inferior to superior and ending at the ASIS, and then on the long side we'll go from superior to inferiorly on the patient. So there's 3 rules for blocking. You'll never adjust on a block, never remove a block to make a correction, and you'll always adjust the major sign. But we'll cover that when we get to the Chris sign. So we'll check the patient, make sure the knees are okay. So any problem with your knees, both sides?
Nope.
Awesome. All right, so we'll pull the patient up, rotate him there, slide the block in. Very good. 45-degree angle both sides. Check this side again, roll them in there. Superior and inferior. Boom. Okay, so we'll patient will be assessing for 10 minutes, maximum of 10 minutes, or before that they equal out, then we're going to be all good. Now we're going to move into our analysis of the crest and dollar sign. So for our crest sign, we're going to use the Davis stretch using our thumbs and Davis contractile using our fingers. Our area is going to be right around the L4, and we're pushing lateral medial, finding which side is the thicker side. So L4, boom, okay, so I'm going to take my thumbs, lateral medial, looks like the left side is, so Davis contractile, same thing, fingers. Left side is kind of our thicker side right there, okay? That's what we're looking at right there. So we have a major crest sign on the left. Now for the dollar sign, the crest sign is going to be a myogenic reflex, and a dollar sign is going to be a neurogenic reflex. The dollar sign is going to be 2 inches medial, 2 inches inferior, and right around where the patient would have pockets. So what I'm going to do is I'm going to push in, finding for tenderness. Okay, still looks like the left side is the more tender one, but the crest sign up here is more of a change in it. So that's going to be our major side. Okay. So since we have that, we're going to we will do an ish tube toggle on the major side, which is our left side, and on the right side we're going to do a crest roll. So we're here on the ish tube, and adjust. Get a good sit there. So clockwise around the patient. On the ASIS, doing the crest roll, and boom, we're there. We're set. Okay. So the next thing we're going to do is our sacral base test, and this is going to happen with my thumb at the L5. So I'm going to palpate for L5, or right here. Okay. So what I have the patient do is breathe in and cough. Boom. Okay. So what happened was my thumb went superior, which means it's going to be a positive. If it had gone towards the head, that would have been a negative. If it had done both, it would be a neutral. For us, the patient went superior, which means I'm going to set the blocks from a superior to inferior aspect. The way this is going to work is on the side over here. We're going to change this. Hold the patient's knee. Here. Boom. So they made a smiley face. Okay. So the way this is going to work now, to assess on the positive, we're going to sit up on the sacral apex, and as the patient breathes in, I'm going to push P to A, and as he breathes out, I'm going to release the pressure. Patient to breathe in, P to A, relax. Breathe in, A, get a big breath in, P to A, on the apex. Very nice. Okay. So now, from there, we're going to the vasomotor with our CAT-1, and we're going to watch, expose the patient's back. What I'm doing is I'm looking for 10 minutes, looking for blotching readiness and tenderness throughout these areas. I see there's one in the lumbar, one right here in the thoracic, and there seems to be one right here in his lower cervical region. So I'm going to palpate those and find out which one is the most tender spot. Right here, sir?
Yep.
This one right here. So this looks, so it's in our thoracic, and we'll go towards the cervical region. Hold that same cervical piece. And then on the thoracic, we'll hold it right here. I'm going to feel on the cervical until I feel most moisture underneath it. Okay? Feel that there. Down that thoracic region where it was most tender, I'll take a knife edge contact and an eye to S pressure, and we'll set. Boom. Patient goes sets just like that. That concludes our CAT-1 video.